really excited to be here and to talk a little bit about digital storytelling, and I think it's actually been set up pretty well by the presentations that have already been talked about. And really, I'm going to be looking at the idea of digital storytelling as a way to explore why. And I think in the healthcare in general, we spend a lot of time speaking about what we should be doing and how it should be done. And we don't spend a lot of time talking about why we should do these things. In particular, why in the terms that a frontline clinician can understand. And we've already mentioned, I think Dr. Alessi's presentation was great, right? And really, that's a big part of the people we need to engage with is the frontline clinicians and tell a story in a way that they can understand and engage with. And so that's a little bit what I'm going to be talking about today. But before I jump right into it, just a couple disclosures. I do own a small production company called Mike Lang Stories, and I'm going to talk about some other digital storytelling groups and some healthcare organizations, but I'm not affiliated with them. I'm not here as a representative of them. And I just wanted to acknowledge the CIHR for funding my PhD research. And if you're surprised that a filmmaker would be getting funding from CIHR, you're not the only one, believe me. When I got the email, I was like, what, really? Okay, this is cool, you know? And but I think it really sort of shows the importance of using stories to engage with people in a meaningful way, because changing beliefs, attitudes, and values are a necessary precursor to any sort of other types of behavioral change, right? And we all sort of understand that intuitively, and there's lots of research to back that up. And I think CIHR is sort of engaging with that in a different way by funding me, so that's pretty cool. So why I'm here, just a little bit. I was actually thinking that my career trajectory was to be a ski patroller. And so I was a ski patroller and whistler, and my only life goal was to ski 200 days a year. That was it. And in the summers, I run these adventure trips with young adults with cancer until I was diagnosed with cancer myself. And that obviously had a huge sort of shift in my life trajectory. My life goals changed a whole lot. And part of me processing the whole cancer experience that I went through when I was 25 years old was trying to find some other patients who knew what it was like to be in your 20s and get cancer. And so I sort of thought, you know, if these adventure trips I was running with kids may be meaningful for them, maybe it would be meaningful for young adults as well. And I actually organized my very first trip. And as sort of an afterthought, I got a couple of my friends who were just getting into filmmaking to come and follow us down the river and chronicle this trip and turn it into a little documentary film. And it was an 8-day kayaking trip that we did. And it really was an afterthought. I was like, oh, that'd be cool to share these stories beyond the people who are on this trip. And it ended up that the film was pretty awesome. And so I took it across the country to pretty much every major cancer center and showed it in grand rounds to doctors and nurses and some in-services and things like that. And I still remember the very first screening I did. It was in Saskatoon. And afterwards, an oncologist, you know, he's sort of sitting in the back of the room. It took a while till he came up to me at the end. He's wearing his lab coat and he had his stethoscope and everything. And he comes up to me, you know, really sort of deep in thought. And he stopped in front of me before he walked out. And he said, you know, I've been an oncology veteran for 20 years. And I think this was the first time that I really understood that when someone is diagnosed with cancer, it's not just their physical health that's at stake. It's their entire identity as a person. And I was like, oh, cool, thanks. I'm glad you learned that, you know? And I was like, and it was a really sort of a surprising thing for me to realize that a story that I'd created, you know, being someone who'd only ever met 8 other people in their 20s who had cancer, that a story could have something to teach someone who had a 20-year sort of background in this field. And that's sort of the first thing that tipped me off to be like, you know what? I think maybe healthcare needs some more stories. You know, maybe we need more things like this. And so I ended up working for a long time with Cancer Control Alberta, and my supervisor there convinced me to go back to school. So I did my master's degree in health services research, looking particularly at using documentary films to sort of help people understand different aspects of the patient experience. And I realized pretty quickly through that project, it's difficult to do in a documentary format because you can't really follow people around with a camera during the most difficult times of their life in the hospital setting, you know, with all sorts of ethical privacy issues, all those types of things. And so I was like, man, I wish there was a way that we could tell the story of what it was like to go through the healthcare system in a very compelling way, but not have to follow them around with a video camera. And then I sort of realized, wait a second, we've all got a video camera in our pocket these days. We all take photos. Maybe we could do this exact same thing using the photos and images and things that people had collected themselves. And so that's what I'm looking at in my PhD is using this idea of digital storytelling to tell people's stories and experiences in a way that people can understand why the things that we're doing matter. And so it was pretty cool. I found out about this idea of digital storytelling. I did some research and I found out they've actually been doing this since the 80s. There's a group down in Berkeley, California called the Center for Digital Storytelling, and they actually did it right when the first iMac came out. They've been doing this. It's a little too bad that it's so long since it came out, because they called it digital storytelling, and obviously this is pre-social media and all that stuff, and that's sort of what we think about when we hear the words digital story, right? We're thinking Instagram, Twitter, things like that. But they weren't referring to that. In particular, we're referring to both a process and a product. And the product is really just a short little 3-minute movie that uses an individual's photos and videos and then some music to tell an important story from their life with some narration. That's the process, it's a product, but it's also a process. And I'll talk a bit more about that, those two different aspects of digital storytelling in a bit. Really, digital stories, I think maybe in a bit more detail, they sort of include sort of a compelling narration of a person's experience. They have some meaningful context as well, and you can get a whole lot of context from just a couple photos, so it's pretty cool how that can happen. And uses images and videos that people have captured themselves. It uses music to reinforce ideas, and then it ideally invites thoughtful reflection from the audience. And so I can sort of tell you what one of those are, but I think it's way better just to watch one. And so I actually got to, before coming to the conference, sit down with one of the patient advisors, Jessica, and create a digital story just for you guys, the first time that anyone will have seen this. And so we're going to watch Jessica's story, and I'll talk a little bit more about it. Here we go.
I have to deal with asthma, eczema, and allergies on a daily basis. My life has been full of splotchy red hives that happen each time I go from hot to cold or cold to hot temperatures. Sweat also exacerbates the eczema. Exercise makes my lungs creak like Darth Vader, and I get so itchy at night that I can't sleep without medication. Eczema goes everywhere with me. When I was 12, my dad told me I'd have these conditions forever and that I'd better go do something with them. So I joined KAYAK, the Child and Youth Advisory Council at Alberta Children's Hospital, even though my conditions were managed outside the pediatric healthcare system. I began to realize in those council meetings that self-management was one of my strengths, because I had to manage my care like an adult. 4 years later, I was able to help develop and lead a self-management workshop for youth with chronic conditions who are transitioning into the adult healthcare system. In those workshops, I shared how I spent hours on the phone booking appointments, and often skipped class to do this because the offices were closed over lunch and after 3 p.m. I explained how in the adult healthcare system you can see multiple specialists, a family doctor, alternative medicine, and counselors, all in a week, and no one will connect the dots for you. To keep track of things, I used my phone as a calendar for symptoms, a checklist for to-do items at appointments, a medication list, and a camera to keep track of my hives. All of this helped my healthcare providers trust what I was saying. During the last workshop I ran, I attended the Canada InfoWay conference. I was so shocked that the things I'd figured out on my own were being studied, put into apps, and promoted. What the heck? Using technology was normal in school and work, but it was the first time I had heard how it could be used in healthcare. My head was spinning. E-prescribing would have helped me actually start my medications on time, instead of losing the prescription slips or taking a month until I could make it to the pharmacy. I wouldn't have had to skip as much math class to arrange appointments if I could have used e-booking. It showed me that empowering patients went beyond putting them on committees. It involved giving them the tools to take charge of their own care. Over the past 7 years, I have 695 hours of volunteering with Alberta Health Services. I have served on 9 different initiatives and councils, And I've spent a lot of hours helping improve the healthcare system, but it was digital health tools that enabled me to help myself. My chronic conditions aren't going away, and I will continue to use the technologies I have to manage my health. I just hope that the healthcare system chooses to do the same.
There you go. Awesome. Yeah, Jessica. So cool. It was really great to work with Jessica on that story. And, I asked her beforehand, I was like, so what was that like for you, and she, a little trepidation, to learn about what it was like for her. But she said it was actually sort of therapeutic, because I was able to sort of showcase all the things that I would been able to accomplish, not just all the things that had gone wrong with my health. And she showed it to her doctor, and her doctor sat there really quietly. And then afterwards, she's like, "Wow, you could make some money with this." And it's sort of cool. You could tell that it influenced her doctor to look at her a little differently, right? And that's what's sort of cool about these stories is everyone takes something different away from it. There's different things that resonate in a story like that. And one of the things that really stood out to me was that one line that she had, right? Empowering patients is more than putting them on committees or planning conferences. It's giving them the tools they need to take charge of their own care. And I think a lot of frontline clinicians would resonate deeply with that, right? And there's so many different ways that you can interpret a story, and that's one of the powers of it. Everyone will take something different from it, and usually it's the thing that they need to take, right? Especially when it comes to changing their own beliefs and attitudes about things. There's also some really other cool things that showed up in there, right? That maybe you wouldn't traditionally associate with any sort of e-health, right? School attendance. This is a very concrete, real thing that would have been influenced in Jessica's life. She wouldn't have had to skip math class, right? And maybe had a better relationship with her math teacher, right? And the medication treatment adherence, right? It's just an example of losing a prescription slip, which I've already heard mentioned once today, but it's told from Jessica's perspective, right? And then finally, trust. A lot of people talked about that today already, but this is a different way. It allowed healthcare providers to trust her when they saw her photos, when they saw her calendar, her medication. They were like, oh, she's an engaged patient. I can work with her on these things in a different way. And I think that trust from the frontline clinician to the patients and vice versa, can be enhanced, by using these different digital health tools. So these are all things, me not having any real background in digital health, learned from her story. And I think there's a lot of things that other people with different backgrounds would learn as well. And that's sort of what's cool about them. So really quickly, how do you make one of these? I've got a paper under review right now, and I can refer that to everyone later. But really, it starts with finding the story. And here, people's healthcare journeys are like epics, like 12-hour documentary sagas, right? But one of the things that I can help them do, and when you do this well, is find moments that have something to teach us about the healthcare system. And it's finding those moments is actually a lot more difficult than you'd think, because most of us don't think about our lives like a story. And that's the next thing, is how do we tell this like a story, right? Do we have an act structure? Is there a story mountain, where with the rising action, climax, resolution, falling action, all that stuff, right? Are we telling a story in that way that actually connects with people emotionally? And then there's the crafting the story. There's all sorts of different ways you can use images to complement the words that people are sharing to bring forth different meanings and deeper meanings. And I was working with Janica, another patient advisor, on a story that will be available after the conference. And she decided to use some imagery of in a plane. And we talk a lot about the patient journey and stuff, but using this image of a plane and flying in the plane, and then also this long sort of jetty that stuck out into the ocean, we visually represent that. And we're visually sort of drawn into the story as a journey without ever saying it with words. So there's lots of ways you can craft the stories to bring a different meaning. And then finally, showing the story. I think there's lots of great stuff out there that's sort of hidden away on the dark corners of the web. So it's really important to actually use these stories and to share them. And so really, digital stories, and I heard someone talking about IAP too. I think it was Aiden talked about that. It's an empower initiative. In the truest sense of the word, right? Because when we're telling stories, we often think first from the organizational level, what do we need? And then we think about, okay, what stories should we be telling to get what we need? And then we say, let's go and find some people who can tell those stories. And that's the complete opposite of how it should be done to get an authentic story. And that's what digital storytelling is completely opposite of that. It starts with the people, right? Who are our people? Who are the people that we should be talking to? Who are the people who use our tools or whatever it is? And then we find out, what stories are they telling? What are they talking about? Maybe it's skipping math class, right? There's all sorts of different things they could be talking about that helps us understand the things that we do in a completely different way. And then finally, we say, how do these stories actually connect to the things that we're doing? Right? And that's the way that it should work if you want truly authentic stories. And I just did a conference with the Canadian Association of Nursing Oncology a few weeks ago, and we shared some stories from Canadian Cancer Society volunteers, and their director of communications came up to me afterwards and said, I learned so much about our stories, about our programs from watching those stories. And it was because it was driven entirely by the patients first and talking about the things that mattered to them. So really, just a quick example of what this could look like. And I do a digital storytelling with Alberta Health Services. We have an entire YouTube channel of digital stories like this. And the very first one is actually the CEO talking about how important it is that we incorporate stories into our clinical practice. And I work with all sorts of different patient and family advisory groups, with specific units or disease groups or hospitals, strategic clinical networks or cancer centers. I've done a few for the new cancer center in Calgary. And they can be group workshops or individual stories. They can be generic. They can be tied to sort of a specific initiative if you want. And the one I put on there is name tags. And really quickly, one of the hospitals had a big problem with people wearing their name tags. And so I sat down with the patient and said, why do name tags matter to you? And she told me this beautiful, heartbreaking story of getting wheeled to an x-ray appointment or a scan and having her chart placed on her lap, and she's sort of flipping through it, and she's like, oh my gosh, everyone knows so much about me, and I don't even know their name. And then she said, the ironic thing after that is the orderly saw her looking through her chart, and he said, hey, you're not allowed to look at that. And, is really, really incredible. And then she also talked about how she wished she could thank her surgeon, but he wasn't wearing his name tag. He never told her who he was. And she couldn't thank him because he didn't know his name. Right? And that just totally flipped the conversation from wearing a name tag as something that doesn't matter to wearing a name tag as something that matters, right? And after that, that specific unit, everyone wore it, right? And we were able to see that and measure that with numbers. Also, the way that we do is we do an annual film festival across the province where thousands of frontline clinicians tune in, watch these stories, and have discussions together as a group. And in particular, a lot of managers love these stories because they can show it at the beginning of a meeting. It's a 3-minute story. They have a 5-minute discussion about it, and then they move on with their meetings, right? And it's a really great way to bring the patient voice into daily clinical operations. And it's difficult to do that without being really onerous on patients and families, advisors, and inviting them to all these meetings all the time, right, to share their story. So there's lots of different ways you can use digital stories. So I'm just going to end with my favorite quote ever from Dr. Rachel Naomi Remen. Facts bring us to knowledge, but stories lead to wisdom. And I think in healthcare and in academia, and probably in industry as well, we're really good at facts and knowledge, are we, right? We know exactly, we can measure things, we can tell people how we should do things and what they should look like. But something we're maybe not super great at is the stories, and listening to the stories and gleaning wisdom from those stories in a way that is relevant to patients and families and the people who are actually using these services. And so really stories are a common language. They are. We hear a lot of talk in organizations about common language, but stories are that common language. Everyone here, because you're a human being, can connect deeply to someone else's story, especially through the images, the words that they use. There's all sorts of different ways and points of connection that you could connect with Jessica's story or any other digital story that's shared in this way. So thank you for having me here, and hopefully you were able to glean a couple pieces of wisdom from some stories that I shared with you today. Thank you.